types of... Hello. In Chapter 12, I'll introduce the structure of skin, different types of burns and scalds. I'll also talk about different levels of burns, the calculation of the percentage of burns, as well as their management and prevention. Skin includes epidermis, dermis, and a layer of fatty tissue. Its functions include protecting internal organs and preventing loss of body fluid. It also keeps bacteria away, regulates body temperature, and excretes body waste. There are different types of burns and scalds. Their causes also differ from each other. Let's match the followings. Your match is correct. Generally, dry burn is caused by flames, contact with hot objects, and frictions. Scalds are caused by boiling water, steam, or boiling oil. Other types of burns include electrical burns, which is caused by low or high voltage currents or lightning strikes, and chemical burns such as burns by strong acid or alkali chemical. There are also cold injuries, such as those caused by dry ice or liquid nitrogen, and radiation burns, such as exposure to a radioactive source or sunburn. Degree of burns determined by the surface area, depth, and body parts involved. The first-degree burn is superficial burn. It affects only the outermost layer of the skin, which causes redness, swelling, and tenderness. The second-degree burn is partial thickness burn. It involves the epidermis and part of the dermis, causing redness, severe pain, and blisters. However, nerve endings of the injured part aren't completely damaged, so there'll be severe pain around the burn wound. The third-degree burn is full-thickness burn, in which the skin is completely damaged, that left with dry wound. Scald wound becomes white, while burn wound becomes charred. As nerves around are damaged, victim may not feel pain at the wounds at all. Let's try to identify the 3 degrees of burn. Let's try to identify the 3 degrees of burn. Your match is correct. You can calculate the percentage of burns through the area of the wounds. The first calculation method is the rule of 9s. It divides the body into sections, with each of them representing 9% of the body surface area. When you calculate the area, the first-degree burn should not be counted, and only the second-degree burn and the third-degree burn should be counted. There are some differences in calculating the percentage of burns for infants and adults, since the infant's head is usually in larger proportion than that of the adults. You'll understand it better after you've incorrect. 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 So we believe all of you can remember the rule of nines after this game. Apart from the rule of nines, you can also use the rule of palm. If the burn doesn't cover the entire section of body surface area of the victim, you can use the victim's own palm to measure the body surface area burned. Each palm size is equivalent to 1% of body surface area. The impact will be different for burns at different parts of the body. Let's take a look at how to manage burns.
Management of minor burns and scalds. Burns and scalds in households, such as burn by iron or hot oil, can be managed as follows. Irrigate the wound with running clear water, such as tap water, until the pain is relieved. Dry the wound and cover it with clean dressing. Avoid unnecessary contact to prevent secondary harm. Get medical consultation as soon as possible if necessary.
You should consider it as critical burns for below conditions and send the victim to hospital for treatment immediately. 1. If the victim has third-degree burn regardless of the area of wound. 2. If the burns involve respiratory tract, face, palm, sole, or genital organs. 3. If burns extend to limbs or round the trunk. 4. If the victim is an elderly, a child, or a person with chronic illnesses. 5. If it's a case of chemical or electrical burn. 6. If over 10% of the victim's body surface area is burned. You should send the victim to hospital immediately in any of the above cases. How to manage a victim with critical burns. You should first perform 3 Bs followed by 3 Cs. The first B in 3 Bs stands for burning stopped. You should isolate the victim from the heat source. If the clothing is on fire, put off the fire or remove the clothing wet with boiling water. The second B refers to breathing maintained. You should examine the victim's breathing. In case of any breathing difficulties, treat it immediately. After that, the third B represents body examine. You should examine the victim for any other serious injuries. If the victim has massive bleeding, manage it and then assess the degree and percentage of burns. After the 3 Bs, you can carry out 3 Cs. The first C refers to cool, that is, cool down. You should irrigate the wound with running clear water to lower the skin temperature until it falls back to normal. Remove tight clothing and accessories such as watches, ring or belt. If you find the victim trembling, you should stop cooling. Don't overcool the victim. The second C stands for cover. That is, cover the wound. You should cover the wound with sterile dressing, clean cloth or cling wrap. The third C represents carry. That is, send the victim to hospital. You should prevent or manage shock and then send the victim to hospital as soon as possible. To have a clearer idea, you can watch the following video on management of critical burns.
Management of critical burns. To manage victims with critical burns, we'll carry out 3 Bs followed by 3 Cs. Burning stopped. Isolate the victim from the heat source. If the clothing is on fire, put out the fire. If the clothing is wet with hot water, take it off. But if the wet clothing has been cooled down already, then you can keep them on. Breathing maintained. Examine the victim's breathing. In case of any breathing difficulty, treat it immediately. Body examined. Examine the victim for other serious injuries. If the victim has massive bleeding, manage it, and then assess the degree and the percentage of burns. Cool. Irrigate the wound with running clear water, such as tap water, to lower the skin temperature until it falls back to normal. During irrigation, remove tight clothing and accessories, such as watches, ring or belt. But don't ever cool the victim. If you find the victim trembling, you should stop cooling. Cover. Cover the wound with sterile dressing, clean cloth or cling wrap. Carry. Prevent or manage shock and send the victim to hospital as soon as possible.
There are some don'ts you should try to avoid when you manage burns. First, don't break the blisters to avoid wound infection. Second, if any clothing sticks to the burn wound, don't remove it to avoid further damage and wound infection. Third, don't apply or offer any medication for the victim. Don't apply toothpaste or cooking oil to the burnt area to avoid tissue damage and infection. Fourth, don't cool the burn wound directly with ice to avoid damage of skin structure. Lastly, don't cool the victim excessively to avoid hypothermia. To prevent burns and scalds, keep matches and lighter out of reach of children. When you boil water, point the opening of the pot to the wall to avoid scald by steam. Make sure the stove is turned off when you move the pot away. When you assist children or elders to take a bath, test the water temperature first. When you iron clothes, keep children away or avoid leaving the iron unattended. Smokers shouldn't smoke on bed. Don't let children touch the container with hot food. Don't use extra long tablecloth to avoid pulling off by children and overturning the container with hot food. Don't overload sockets. Choose furniture items with non-inflammable materials. If you find your clothes catching fire, you can use blanket, quilt or other clothes to wrap the burning parts. You can also splash with water. After the fire is extinguished, manage the burn. Inhalation injuries refer to the damage to the respiratory tracts by inhaling hot air or gases. As the airway gets burned, causing edema in the mucus of the airway and result in blockage of the airway and breathing difficulty. The causes are usually the inhalation of hot air or fumes. Signs and symptoms of inhalation injuries include burns on face and singed eyebrow or nasal hairs. The victim will also have carbon deposits and inflammation around the mouth or throat, smell of smoke in the mouth and cinders in sputum. He or she may experience difficulty in breathing or swallowing and have coughing, hoarse voice, and a decreased level of consciousness. The victim is likely to have history of being trapped in a confined smoky space. Victim with inhalation injuries should be managed with top priority. You should isolate the heat source from the victim. Meanwhile, check the victim's breathing and perform CPR if necessary. Send the victim to hospital as soon as possible. We'll proceed to scalds. One of the type is throat scald. Causes include swallowing very hot food or corrosive chemicals that may burn the throat. This would result in edema and suffocation. When you perform first aid, you need to check the victim's breathing and perform CPR if necessary. If you suspect that the victim has drunk corrosive liquid, you should use protective gear for artificial ventilation. Do not attempt to dilute the swallowed corrosive chemicals and send the victim to hospital as soon as possible. Chemical burn is common in some working environment. There are two types of chemicals that can cause critical burns, namely strong acid and strong alkali. Before you manage the victim, you should wear protective gown, mask and gloves. After that, irrigate the burn area with clean running water, such as tap water, until painless, and prevent the used water from contacting the victim's non-injured part, skin or tissues. Gently remove contaminated clothing. If you find other wounds on the victim, treat them as well, such as bleeding management. After that, send the victim to hospital as soon as possible. If some special chemicals are involved in the burns, the management would be different. If the chemical involved is phosphorus, it'll catch fire once it's exposed to air. In general case, the principle of burn management is to keep the wound dry, but phosphorus burn is an exception. If you find phosphorus particles on the wound, you should remove or rinse away the particles immediately. Then cover the wound with wet dressing and bandage it. You should keep the dressing wet when the victim is transferred to hospital to avoid further damage to the wound. If the chemical is lime, it'll dissolve in water and produce a large amount of heat that can cause burn. Therefore, you should brush lime particles away before irrigation. If the chemical is hydrofluoric acid, its fluoride ion may cause skin erosion, leading to damage of soft tissues, bone destruction and decalcification. Once the chemical is absorbed by skin contact, inhaled or swallowed, the fluoride ion will cause tissue toxicity and electrolytes imbalance. This will result in damage of the heart, lungs, or gastrointestinal tract. You should protect yourself from chemical burn and send the victim to hospital. If the victim has electrical burn, you should cut off the electric current, such as turning off the power and isolating the victim from the electric source. If the victim has no breathing and signs of circulation, perform CPR. You should also check if the victim has other injuries. After that, cover the burn area with non-adhesive sterile dressing and send the victim to hospital as soon as possible. If the victim has high-voltage electrical burn, he or she may be thrown away from the source. You should carry out rescue and appropriate management according to the victim's situation. If the victim is still in contact with the cable or close to the cable, don't attempt to rescue him or her. Don't try to climb up the cable tower or column for first aid. Anyone must be at least 18 meters away from the cables. You should try to turn off the main power and call the police immediately. The rescue of victim with high-voltage electrical burn is extremely dangerous. There's no absolute safe way to follow. You should only perform rescue after you're certain that the cable isn't conducting, or the current has been completely cut off or earthed, or the crane tower and other tall objects aren't touching the cables. To prevent electrical burns, you should keep all electronic appliances checked and in good maintenance regularly. Don't overload sockets. Don't touch a switch with a wet hand. Don't allow children to touch electric socket and appliances. Also, don't repair electronic appliances by yourself. Sunburn may lead to serious burns. Overexposure to the sun may lead to first degree or second degree of burn in a short period of time. But it is usually just a mild condition. However, if the victim feels exceptionally unwell, you have to send him or her to hospital for treatment. When you manage victim with sunburn, place the victim in shaded area or indoor area. Cover the burn with cold, wet dressing. Give the victim frequent sips of cold water. If the victim feels pain and shows redness in the eyes, cover the eyes with wet dressing. Send the victim to hospital if necessary.